The United States is facing a healthcare crisis. In 2020, according to census.gov, over 28 million US citizens did not have healthcare insurance at some point in time during the COVID pandemic. The affordability of healthcare insurance is dramatically increasing due to the cost of availability of state-of-the-art medical technologies and prescription drugs. Studies conducted by the Kaiser Family Foundation claim that even after Obamacare Act of 2019, 73.7% of uninsured adults said that they were unable to get insurance due to the coverage being so high. Many people do not have access to coverage through a job. Some people, particularly poor adults in states that did not expand Medicaid, remain ineligible for financial assistance for coverage. Additionally, undocumented immigrants are ineligible for Medicaid or marketplace coverage. In this documentary, we'll go over three main components. First, the cost of healthcare insurance. Second, why healthcare insurance is needed. Third, the solution for providing nationwide healthcare. So what is healthcare? Healthcare insurance or medical insurance is a type of insurance that covers the whole or a part of the risk of a person incurring medical expenses.
The cost of healthcare. Across the United States, Americans pay widely different monthly premiums for health insurance. It varies due to a few factors, like if you are purchasing insurance from your place of employment, what kind of package like group, family or individual plans, and each type of package has different grades that determine your copay, deductible, and even what doctors you may have. People who do not have healthcare insurance are at risk of accumulating vast medical bills if sick or uninjured. The Kaiser Family Foundation claims that when the uninsured are hospitalized, they receive fewer diagnostic and therapeutic services and also have higher mortality rates than those with insurance. Research demonstrates that gaining health insurance improves access to healthcare considerably and diminishes the adverse effects of having been uninsured. Also, the economic downturn caused by the coronavirus pandemic has renewed attention on health insurance coverage as millions have lost their jobs and potentially their health coverage. A penalty comes along when you are not insured. The annual penalty for Californians who have no health insurance is 2.5% of household income, and an approximate cost for each adult in California is $800. For a dependent who is under 18, the cost is $400 monthly. The dollar figures will rapidly start rising yearly due to inflation. There are two ways of obtaining healthcare insurance. You may purchase private coverage or public coverage. According to the private health insurance versus public health, private coverage is offered by a private entity instead of a state or federal government. The public coverage is provided by the government and is available to low-income individuals, families, and elderly, and others that qualify under special groups. According to healthcare.gov, there are three types of popular plans that private insurance companies offer: HMO, PPO, and EMO. Health Maintenance Organization, HMO, a type of health insurance plan that usually limits coverage to care from doctors who work for or contract with the HMO. It generally won't cover out-of-network care except in an emergency. An HMO may require you to live or work in its service area to be eligible for coverage. HMOs often provide integrated care and focus on prevention and wellness. Preferred Provider Organization, PPO, a type of health plan where you pay less if you use providers in the plan's network. You can use doctors, hospitals, and providers outside of the network without a referral or an additional cost. Exclusive Provider Organization, EPO, a managed care plan where services are covered only if you use doctors, specialists, or hospitals in the plan's network, except in an emergency. According to the charts you can see from 2014 to 2020, packages and plans are at a steady increase, but it is still beneficial to have health coverage rather than paying out of pocket. Only Gold plans showed a decrease in average premium for 2020. Platinum $732, Gold $569, Silver $483, Bronze $448. And $195 was the average premium for catastrophic plans. Only average Bronze family plan premiums decreased from 2019 to 2020. Platinum was at $1,610, gold $1,437, silver $1,212, and bronze $1,041. To continue, there are also types of public insurance, like for example, Medicare and Medicaid. Medicare is a federal program that provides healthcare coverage if you are 65 years old and over, or under 65 years old with a disability, no matter your income. Medicaid is a state and federal program that provides health coverage if you have a very low income, so they will work with you to provide you with health coverage. Most plans are premium free or very inexpensive based on annual income.
Now that we have talked about the cost of healthcare, let's talk about the need for healthcare. Healthcare is needed for many reasons, but one of which is for financial protection. This means to keep yourself protected from extreme costs of things like medication, injury treatments, physical examinations, and many other costly procedures. Let's start with medication costs. We use the example of insulin. For those of you that don't know, insulin is something that diabetics need to take. According to commonwealthfund.org, the average out-of-pocket cost for insulin over a year would be about $613 with private insurance, which means the insurance covers partial costs while you pay the remaining balance, which also means copaying. About $23 out of pocket when you have public insurance, and about $1,288 with no insurance. People who have health conditions like diabetes, asthma, heart conditions, and many more need health insurance to keep them from drowning in debt by having to pay thousands of dollars for medication that they need. Injury treatment costs can be very pricey depending on what you need. I am going to be comparing the cost for a broken leg that only needs a cast. Private insurance will cover about 60 to 90% of expenses, meaning the remaining 10 to 40% of costs would come out of pocket. For public insurance, a cast will most likely be covered completely with little or no out-of-pocket costs. And lastly, according to healthcare.org, people who are uninsured would be charged about $7,500 for a leg cast. Annual physical examinations don't cost as much as other medical expenses, but it is still expendable funds that could remain in your pocket. With private insurance, the copay amount for a physical could range from about $10 to $50. With public insurance, a physical is completely covered with no out-of-pocket expenses. And according to TalkToMira.com, the cost for a physical with no insurance can range from $50 to $200. Another reason healthcare is needed, according to the Inquiry Journal of Chicago, is because having healthcare can reduce both health-related and non-health-related debt. This is because when income is available for other debts, then funds could be used for economic growth. Since there would be no debt in your name, your credit balance or credit score could increase. According to commonwealthfund.org, people without insurance are often in poor health conditions due to deferred treatment and uncontrolled chronic conditions. Poor health results in loss of productivity. Workers tend to miss more days of work because of health problems, and workers are less productive because of their health conditions. Results from a study that was published in academia.edu shows that uninsured workers missed almost 5 more days of work each year compared to those who had insurance.
Now I'll be talking about the national solution. With the annual increase of rates for health insurance premiums, the cost for out-of-pocket expenses, we need to find a national solution. According to the U.S. Department of Health and Human Services in 2020, the poverty line for a family of 4 was an annual income of $26,200. For a single person, it was $12,760. In 2019, official estimates determined that 34 million Americans were living in poverty. As you can see in the chart, problems paying medical bills by insurance status 2019, you can see that 74.9% of those insured are unable to pay any medical bills at all. 73.8% of those who are on Medicaid or other public insurances are unable to pay any medical bills at all, and 53.0% of them who are on other private insurances are unable to pay any medical bills at all. According to the health.ny.gov, It states that 43 countries in the world offers universal health care. On the OECD BetterLifeIndex.org, the United States is ranked 7th in overall health of its citizens. Canada, New Zealand, Australia, Israel, Ireland, and Switzerland all have implemented universal health. Universal health coverage means that all people have an access to the health services they need when and where they need them without financial hardship. We need to follow the other 43 countries and implement universal health care coverage to remove Americans' medical expenses. Using Canada's example, the federal government funds providential territorial governments and the health departments who negotiated with medical associations and healthcare professional unions to lower costs of medical expenses, then extend the healthcare benefits to Canadian residents. As shown in cost comparison chart of drug prices, as of June 2020, Canadian and US prescription drugs conducted by the Campaign for Personal Prescription Importation found that the brand name drugs that patients seek in America and are actually available at up to 88% in savings from licensed Canadian pharmacies. This due to the negotiation that the Canadian government conducts with the medical associations. Currently, in Canada, 100% of their citizens have health care. Main reason why they are ranked number 1 in OECD Better Life Index, and about 67% of Canadians purchase additional insurance for vision, dental, and prescription drugs.
In conclusion, we have gone over in detail life without health insurance, the cost of health insurance, the need for health insurance, and the national solution of implementing universal health care to reduce and remove high expenses of medical bills and to promote a better quality of life for Americans. Thank you.